How do I manage my diabetes? Knowing the ABCs of diabetes will help you control your blood glucose, blood pressure, and cholesterol. Quitting smoking, if you smoke, will also help you manage your diabetes. Working toward your ABC goals can help reduce your chances of having a heart attack, stroke, or other diabetes problems. The A1C test shows your average blood glucose level over the past 3 months. The A1C goal for many people with diabetes is less than 7%. Ask your healthcare team what your goal should be. The target blood pressure level for most people with diabetes is below 140/90 mmHg. Ask what your target should be. There are 2 types of cholesterol in the blood, LDL and HDL. LDL or bad cholesterol can build up and clog blood vessels. Too much bad cholesterol can cause a heart attack or stroke. HDL or good cholesterol helps remove bad cholesterol from blood vessels. Ask your doctor what your cholesterol numbers should be. If you are over 40 years old, you may need to take a statin for heart health. Smoking cessation is especially important for people with diabetes because both smoking and diabetes narrow blood vessels. If you stop smoking, you will lower your risk of heart attack, stroke, nerve disease, kidney disease, diabetic eye disease, and amputation. Your cholesterol levels and blood pressure may improve, your circulation will improve, you may find it easier to be physically active. Keeping your A1C, blood pressure and cholesterol levels in line with your goals and quitting smoking can help prevent the long-term harmful effects of diabetes. These health problems include heart disease, stroke, kidney disease, nerve damage and eye disease. You can track your ABCs with a diabetes treatment record. Take it with you during your doctor's visits. Talk about your goals and how you are doing and whether you need to make any changes to your diabetes treatment plan. Follow your diabetes meal plan. Make a meal plan. Following a meal plan will help you control your blood glucose, blood pressure, and cholesterol levels. Drink water instead of sweetened beverages. Choose foods that are low in calories, saturated fat, trans fats, sugar and salt. Learn more about food, diet and nutrition for diabetes at the link in the description or in the comments. Make physical activity a part of your daily life. Set a goal to be more physically active. Try to get up to 30 minutes or more of physical activity on most days of the week. Brisk walking and swimming are good ways to move more. If you are not currently active, ask your doctor what types and amounts of physical activity are right for you. Following a meal plan and living a more active lifestyle can help you maintain or reach a healthy weight. Take your medicine. Take medicine for diabetes and any other health problems even if you feel well or have reached your target blood glucose, blood pressure, and cholesterol levels. These medicines can help you manage your ABCs. Ask your doctor if you need to take aspirin to prevent a heart attack or stroke. Tell your doctor if you can't afford your medicines or if you have any side effects from your medicines. For many people with diabetes, checking blood glucose levels daily is an important way to manage diabetes. Monitoring blood glucose levels is most important if you are taking insulin. The results of blood glucose monitoring can help you make decisions about diet, physical activity, and medication. The most common way to check your blood glucose levels at home is to use a glucometer. You can get a drop of blood by pricking your fingertip with a lancet. You then apply the blood to a test strip. The glucometer will show you how much glucose is in your blood at that moment. Ask your doctor how often you should check your blood glucose levels. Be sure to keep a record of your blood glucose self-check results. Continuous glucose monitoring, CGM, is another way to check your glucose levels. Most CGM systems use a tiny sensor that you insert under your skin. The sensor measures glucose levels in the fluids between your body cells every few minutes and can show changes in glucose levels throughout the day and night. If the CGM system shows that your glucose levels are too high or too low, you should check your glucose levels with a glucometer before making any changes to your diet plan, physical activity, or medications. CGM is especially helpful for people who use insulin and have problems with low blood glucose levels. Many people with diabetes strive to keep their blood glucose levels at normal levels. Before meals, 80 to 130 milligrams per deciliter. About 2 hours after starting a meal, less than 180 milligrams per deciliter. Talk to your doctor about the best target range for you. Be sure to tell your doctor if your glucose levels are often above or below the target range. Sometimes blood glucose levels fall below the proper level, which is called hypoglycemia. For most people with diabetes, blood glucose levels are too low when they are below 70 milligrams per deciliter. Hypoglycemia can be life-threatening and requires immediate treatment. Doctors refer to elevated blood glucose levels as hyperglycemia. Symptoms that blood glucose levels may be too high include feeling thirsty, feeling tired or weak, headaches, frequent urination, blurred vision. If you often have high blood glucose or symptoms of high blood glucose, talk to your doctor. You may need to change your diabetes diet plan, exercise plan, or medications. Your doctor may ask you to test your urine for ketones if you have symptoms of diabetic ketoacidosis. When ketone levels become too high, you may develop this life-threatening condition. Symptoms include difficulty breathing, nausea or vomiting, abdominal pain, confusion, feeling very tired or sleepy. Ketoacidosis is most often a problem for people with type 1 diabetes. Most people with diabetes get their health care from a primary care specialist. Primary care specialists include general practitioners, family doctors, and pediatricians. Sometimes primary care is provided by physician assistants and nurses with additional training called nurse practitioners.
You will also need to see other care professionals from time to time. A healthcare team can help you improve your diabetes self-care. In addition to a primary care specialist, your healthcare team may include an endocrinologist for more specialized diabetes care, a registered dietitian, also called a nutritionist, a nurse, a certified diabetes educator, a pharmacist, a dentist, an eye doctor, a podiatrist or foot doctor for foot care, a social worker who can help you find financial assistance for treatment and community resources, a counselor or other mental health professional. When you see members of your healthcare team, ask questions. Write a list of questions you have before your visit so you don't forget what you want to ask. You should see your primary care physician at least twice a year or more often if you have problems or are having trouble reaching your blood glucose, blood pressure, or cholesterol targets. Talk to your doctor about your medications and whether you need to adjust them. Regular medical care can help you detect and treat any health problems early. Talk to your doctor about which vaccines you should get to keep you from getting sick, such as flu shots and pneumonia shots. Disease prevention is an important part of diabetes care. Your blood glucose levels are more likely to rise when you get sick or have an infection. Feeling stressed, sad or angry is common in people living with diabetes. Stress can raise blood glucose levels, but you can learn how to reduce stress. Try deep breathing, gardening, taking a walk, practicing yoga. Try to get 7 to 8 hours of sleep each night. Getting enough sleep can help improve your mood and energy levels. If you often feel sleepy during the day, you may have obstructive sleep apnea, a condition in which your breathing stops briefly several times during the night. Sleep apnea is common in people with diabetes. If you think you are having trouble sleeping, talk to your doctor. Remember that controlling diabetes is not easy, but it is worth it.